Hello, professionals. This is Dr. Saad, and as you know, we are recording series of our lectures for pharmacists who are going to appear for international equivalency exam. And in previous video, we discussed about the implication of autonomic nervous system. As you know, this is as a just for your information, this is our last recording for the nervous system, and next recording will be for the central nervous system. This is the last recording for autonomic nervous system. So let's come to our topic directly without wasting more time. As we in previous video discussed about the implication of autonomic nervous system drug in excretory system, in respiratory system, and especially in eyes. Now let's talk about the gastrointestinal tract. As you know, there is a condition known as post-operative or neurogenic ileus. It's a condition when patient can tolerate anything. We manage this even there is no physical sign of obstruction. There is sometimes for this such type of patient require total parental nutritions. So to manage such a type of condition, we need to increase our acetylcholine neurotransmitters. For that, we will use a cholinergic agonist, or we will use acetylcholine esterase inhibitor. Both factors will ultimately increase the muscarinic transmissions. In second condition, that is the motion sickness, post-operative nausea, and vomiting. This is managed by the use of anti-muscarinic action of muscarinic receptor, and its example is the scopolamine. Third condition is the irritable bowel disease, or you can say irritable bowel syndrome. This condition is also being managed by anticholinergic drugs. That's example is the dicyclomine or hyoscyamine. And next section of our body, system of our body, that is the muscles. It is controlled by the use of this transmission in specific condition of myasthenia gravis and muscle as in muscle relaxants. Myasthenia gravis we have discussed in a very detailed way, where we saw that because of the drop in level of acetylcholine, our muscle stop functioning and paralysis, fatigue, or this type of symptoms were visible because of the drop in its acetylcholine level. So we use acetylcholine esterase inhibitor to increase its level. And this is all about the myasthenia gravis application. Next is the as a muscle relaxant. We use alpha 2 agonist, or you can say uh, adrenergic agonist, tizanidine, for as a muscle relaxant. It is commonly available pharmaceutical preparation. It is available in 2 mg and 4 mg form of tablet. So this is about the muscular implication at muscular system. And third is about antidote. It is very common as we discussed about it. Anticholinergic drugs. Its example is atropine or pralidoxin. It is used as an antidote of organophosphorus poisoning, which is often designed for the insecticidal. But if mistakenly human exposed to this poison, then we use anticholinergic drug as an antidote. Fourth section of our implication is about the cardiovascular system. Actually, autonomic nervous system drugs used extensively in cardiovascular system. Just for a review and a flash, I just mentioned some examples how we are using it in cardiovascular system. There is a case known as orthostatic hypertension, and for one agonist is used for this. For hypertension, we were using alpha 2 agonist or beta blockers. For hypertensive emergency, we're using beta, so we're using D2 and dopaminergic receptor D2 agonist. And for cardiogenic shocks and acute heart failure, we're using beta 1 agonist. And for angina and arrhythmia, we're using beta agonist, beta blockers, sorry, beta, with for angina and arrhythmia, we're using beta blockers. And when these require a rapid control on hypertension, arrhythmia, and myocardial ischemia, then we use specially known as esmolol. This drug is very effective for the rapid control of such type of conditions. And now this was all about a review about the review for the implication on cardiovascular system. Next is about the Parkinson disease. We use bromocriptine for that, and pheochromocytoma. We have already discussed it when we talked about the tumor in adrenal gland, which increases the norepinephrinic hormones, which is controlled by the use of uh, alpha blocker drugs, that is the few phentolamine. Its example is phentolamine and phenoxybenzamine. These are the example of these drugs. You can say metyrosine is also being used for to counter the pheochromocytoma. Next is, and last implication is about the prolactinism, prolactinia, or high level of prolactin in the body. For that, we use dopamine receptor agonist. Its example is bromocriptine or cabergoline. These are the example of these drugs. So these are the implication. You see, almost we are using adrenergic and cholinergic receptor to manage the various condition of our body to counter the different ailments. So this was all about the implication of autonomic nervous system. Now we are going toward next section, that is about the just review of overall drugs used under this system. We will discuss about the drugs of cholinergic agonist, antagonist, adrenergic agonist, and antagonist, and their subdivisions. Just for a review, so that you can easily get our point and you have an idea about pharmacology of these drugs. And as we move for our further recording, and we'll discuss about respiratory system and cardiovascular system in a detail as a separate system. In there, we will discuss this section again for our to justify our therapeutic plannings. So let's talk about the drug classification, that is the that is the cholinergic agonist. First of all, its subsection is about direct acting cholinergic agonist. These are those drugs which increase the level of choline, acetylcholine. So its example is buthanacol, carbachol, pyrocarbine. Similarly, direct acting nicotinic agonist. Its example is nicotine vernicillin. It's a very common drug used for smoking cessation, and nicotine patches is also used, as I told you. And correspondingly, ACE inhibitors, acetylcholine esterase inhibitor. This is an enzyme which splits acetylcholine and make acetylcholine dysfunctional, so we block this hormone. Its example is for short acting adrophonium, for intermediate acting neostigmine, pyridostigmine, physiostigmine, and for long acting drugs, example is malathion, parathion, and serine. This is one of the notorious drug which is also known as nerve agent, and it is used for some warfare purposes. So malathion and parathion are also used for insecticides. Actually, we use long-acting acetylcholinesterase inhibitor to for as an insecticide, and it is also used as a poison. So this was cholinergic agonist drugs. Next is about cholinergic antagonist drug, and its example is scopolamine, dicyclomine, atropine, hematropine, cyclopentalate, tropicamide, ipratropium, tiotropium, oxybutylene, dorifenacin, solifenacin, and pyridoxine. These are the drugs we use as an anticholinergic drugs. Next is the adrenergic agonist, alpha 1 agonist, midodrine, and alpha 2 agonist is example is clonidine, methoxy, methyl dopa, methyl dopa, tizanidine, aproclonidine, brimonidine. These are the example of alpha 2 agonist drugs. And another example, that is dexmedetomidine. This is an example like this one. I think you got my point. Dexmedetomidine is also used as an sedative agent. It is used for with the anesthetic drugs. Beta 1 agonist is example is the dobutamine. Beta 2 agonist example is the short acting and long acting beta 2 agonist, as we discussed in the application. I will discuss about it. I will tell you about this is the albuterol for short acting, salmeterol, salbutamol and terbutaline for long acting, salmeterol, formoterol, and albuterol is an example of beta 2 agonist drug. Beta 3 agonist drug is mirabegron, and the D1 agonist is the phenyl-dopa, and D2 agonist is the bromocriptine, and cabergoline is also example of this one. Adrenergic, these are all about adrenergic agonist drugs. And next, that is the last section of our this ANS drugs is adrenergic antagonist. So first of all, we'll discuss about the alpha 1 and alpha 2 antagonist drugs. Its example is phentol, phentolamine, phenoxybenzamine. It is specifically used for the pheochromocytoma. I think you can recall that point. Next is the alpha 1, specifically alpha 1 antagonist. Example, the prazosin, doxazocin, trazocin, and tamsulosin. And next is the alpha 2 antagonist. Its example is the yohimbine. And next is about beta antagonist or beta blocker drugs. Beta 1 and beta 2, those drugs block both receptors. Now you can say non-selective, that is the beta 1 and beta 2 receptor blockers. It's the propranolol, nadolol, and timolol. Next is the if some drugs which blocks more to beta 1 blocker, those drugs who are more beta 1 blocker than that of beta 2 blockers, although they have some specific effect on beta 2. Its example is the metoprolol, atenolol, and nebivolol and bitoxolol. And next class is about those drugs who blocks more beta 2 receptor than that of beta 1 receptors. Its example is butoxamine. Now again, there is another interesting class, that is the beta 1 beta 2 agonist, as well as it also have some intrinsic sympathomimetic activity. This is something really interesting. Like there's a drug that is actually acting as a beta 1 and beta 2 agonist, and it also have a sympathomimetic like cholinergic agonist action. Its example is the pindolol, acetylbutylol, cartiolol, bopindolol, oxprenolol, C, chlorol, penbutolol. These are the example of this drug. Now there is a drug, some drugs who are more in those drugs who are more beta 1 blocker and less alpha 1 blocker. So look, these drugs are not specifically, like if you say beta blocker, they are not specifically beta blocker. They are also acting as an sympathomimetics, and they are also acting as an alpha blocking actions. So here I am telling you about the beta 1. Those drugs who are more blocker at beta 1 receptor than that of alpha 1 receptors. This means they are also blocking alpha 1 receptors. Its example are carvedilol, medroxylol, bosindolol, and labetalol. These are the example of this drug. So in last, that is the thyroid hydroxylase inhibitor. Its example is the metyrosine. So it is, if as I told you in implication, when there is an emergency, then there is a drug which belongs to more beta 1 selective than that of beta 2 selective. Its example is esmolol. Whenever there is an emergency of hypertension, arrhythmia, angina, in that case this drug is used to control the situation. So this was all about autonomic nervous system, and this we discussed it all those points in our previous 4 to 5 videos, which can be asked in MCQs question, which can be the part of technical questions, which can be the part of upcoming international equivalency exam of even any country from this chapter. And once who you prepare, you listen to our videos and have a grip over your previous university notes, then you will definitely going to attempt almost majority of questions very effectively. Side by side, if you want to be a well professional pharmacist and a physician, then this background is going to be very helpful for you to draw an logical and a proper therapeutic regime, so that it can be justified by multiple arguments. So this is the here we are going to close this autonomic nervous system, and next, from the next video, we will start central nervous system, and the pattern would be same. First of all, we will discuss its physiology, pathophysiology, and then we will move toward the various diseases, their mechanism of action, their implications, and ultimately we summarize drug. And we will try our best to recall all these points with a reference to some clinical implication, because clinical implication play a key role to maintain long-term memory. Otherwise, by keeping the list of drug in your mind or recalling will definitely keep you will not going to be a very long-term benefit. It will immediately vanish from your mind. So thank you so much. And if you feel that our this effort is going to be very helpful for you or helpful for you, then please subscribe our channel and stay tuned.